Imagine trusting someone with your life, only for them to end it. Harold Shipman, once a trusted general practitioner in England, turned that trust into a lethal weapon. In 2000, he was convicted of murdering 15 of his own patients. But by then, the official inquiry estimated he had killed at least 250, possibly even more. This is the story of Dr. Death and the system he exploited. Harold Frederick Shipman was born in Nottingham on the 14th of January 1946 into a working-class family, the second of 3 children. His father worked as a lorry driver, and his mother died of lung cancer when he was 17, an event that would haunt his life and possibly shape his future crimes. He graduated from Leeds University's School of Medicine in 1970 and began his career as a general practitioner. By 1974, he was practicing in Todmorden, West Yorkshire. In 1975, he was caught forging prescriptions for pethidine, fined £600, and referred to a psychiatric unit. Yet the General Medical Council only issued a warning, allowing him to continue practicing. Over the next 2 decades, Shipman exploited his medical authority, administering lethal doses of diamorphine, pharmaceutical heroin, primarily to elderly patients. He often signed death certificates citing natural causes, and his crimes remained hidden under the guise of routine doctoring. The Shipman Inquiry concluded he was responsible for the deaths of at least 250 people, with some estimates suggesting the number could be even higher. Suspicions surfaced in early 1998 when a local funeral director, Deborah Massey, noticed an unusually high number of Shipman's patients were being cremated. Yet, initial investigations did not lead to charges. It wasn't until the death of 81-year-old Kathleen Grundy, whose will, bizarrely, named Shipman as sole beneficiary, that the alarm bells truly rang. Her exhumed body revealed lethal traces of morphine, and forged documents, including a doctored will, provided the evidence needed to arrest him in September 1998. He went to trial, and in January 2000 was found guilty of 15 counts of murder and 1 count of forgery. He received a whole life sentence, effectively spending the rest of his life behind bars. Shortly after, the Shipman Inquiry, chaired by Dame Janet Smith, began its exhaustive investigation. The final report, released in January 2005, drew on thousands of witness statements and hundreds of thousands of pages of evidence. It confirmed over 250 victims across decades of abuse and identified systemic failures in death certification procedures, prescribing guidelines, and regulatory oversight. On the 13th of January 2004, one day before his 58th birthday, Shipman was found dead in his Wakefield prison cell, having taken his own life. His death sparked further reforms in medical oversight and death reporting, but it also left a chilling legacy: the betrayal of trust by the person society relied on most for care. This was not just a crime story, it was a systemic failure. A healer turned killer, a community betrayed. How strong are the safeguards today? Could something like this happen again? If you're ready for more true crime stories told with restraint and insight, subscribe and join us for the next chapter.